And what you're looking at is my old medication. This is Advate with Baxcheck 3 system. Now, it's kind of clickbaity, but I do want to talk about how your insurance company doesn't give a fuck about you when you need help. Now, I work with a program that's got a government program and a personal insurance. So private insurance and a government program. And they're doing this much for me for my new medication. So what you saw in the thumbnail is the Hemlibra, which is my new medication. Okay, this is the old one, and this is used for emergency doses. And then I have the new one. I don't know what's going on. I might have to talk to my doctor about going back to my old medication because what's pissing me off is that not everybody is perfectly healthy. Now, when COVID happened, there was always a worry that I have severe hemophilia type A. There was always a concern that what if the hemophilia is a comorbidity factor when mixed with the COVID-19 would make me sick. No such thing has happened. No such thing ever happened. But there was always those question marks were always hanging in the air as to whether or not I would get worse from 2020 onward. So I've had hemophilia since I was born. My two brothers died for it. My cousin died for it. I had hepatitis C from human blood, which was used in medication. So originally I was using a factor 8 anti-hemophilia medication that was using human blood. And it was human blood. It's like, okay, you could grab human blood off of anybody off the street. As long as the human blood type matched mine, then you could make anything with it, right? Usually type O is probably the best type. Problem is, people got AIDS, people got syphilis, people got all kinds of shit, right? So after the 80s, there were class action lawsuits. And now everything is checked. Everything is checked. With blood drives, they check everything. They check every kind of plasma to make sure there's nothing in there to get anybody sick. So now that's taken care of, right? And eventually we use different kinds of recombinants. Advate does not use human blood. It uses other kinds of replacements for plasma, but all to raise my blood factors. So what this does here, it temporarily gives me factor 8 because your blood has like multiple factors. I would think it's like 12 or 13. And when you don't have a factor in there, that means you're positive for hemophilia. Okay, there's different kinds of blood disorders, but hemophilia is one of them. So here I am, like with this Advate, right? Advate means you have to do it prophylactically, meaning you have to do it every other day, 2 to 3 times a week. When I got to Hemlibra, which is a new one, right? It's a medication you take for your blood to clot, essentially for once every 30 days or once every 2 weeks. I took the 30-day program. What does all this mean, right? So when you get a bleed, like if you fall off your skateboard, I fell off my scooter like a month ago or so. I still have not fully recovered from that, and I have to take some pain medication in a bit just to forget the pain. And I'm getting old, right? So when you get bleeds, when you get bruises, when you get bleeds, meaning I remember I had my hands would swell up, my arms would swell up, my feet, my legs. I had like blood removal. My knee was like it was like a double D breast, It was like a double D boob, and it was so bad that I was in so much pain. I had to go for like outpatient surgery, and I had something else with my appendix. That was something else not related to this, but I had to go for my appendix removal in '99, and then in 2003, we're not in the anniversary is in December, but in 2003, I had my synovectomy, which is the bleeding disorder is so bad, right? Imagine this is a knee, so it if your knees are good, you got like tissue in there in between the bones and joints, so you're running right. You're running track and field. There you go, running right. But when there's iron deposits, which can clot up your joints, okay, then it's like this, okay. So imagine this is my well, actually, it's my left knee. So it's at this point where it doesn't work as well. They had to take out my doctor, Dr. Luck for my hospital. He took out a lot of iron deposits that were building up and destroying the tissue. So now I just can't run. I can kind of do this. I can kind of jog a little bit, but I cannot run anymore. It just doesn't happen. I have problems with my ankle joints. There's some arthritis to be sure, and that's part of having hemophilia. I remember my dad told me that hemophilia people used to be bedridden. You know, my mom told me that her brother-in-law, my uncle Pablo, who the wife beater, remember him? Remember that guy? So he wanted to have my cousin, his son Gabriel, tied to a bed because of the hemophilia. Like we should just confine him that way and not let him loose, because what's the point? So there were a lot of problems that hemophilia had caused. I had an uncle. My mom's brother died at 3 years old from a failing blood clot in his brain. He died. The blood went to his brain, and he died. I never met my uncle. So hemophilia. I mean, Alex Borstein has it. Her brother definitely has severe. Family Guy, right? Meg, no, not Meg. Lois Griffin, right there, right? Mad TV. So yeah, she has a. Women have a recessive order, meaning they have all the characteristics of hemophilia, but they still have all their factors. But if they get pregnant and they have a son, the son will have hemophilia. That's basically how genetics work. So hemophilia is genetic, and my sisters knew that. My cousin Elba, who passed away, she knew that. She didn't care. She had a son who I saw at the funeral who does have severe hemophilia. But we get to this point now, and this has happened twice, okay, where I'm trying to get the Hem Libra, the new one, that one that takes 30 days. And my insurance company is giving me the fucking runaround. And it's a back and forth. Basically, they're not withholding it. They're withholding it. It's basically that they're withholding it unless I pay $100, because neither my government program or my private insurance will pay for all of it. The private insurance will pay for half of it, and the government program is supposed to pay the other half. The government program's like they're not doing fuck all, right? So now I'm stuck, and I have to go and apply to an institute that's supposed to help cover the bill. This is like the second or third time this has happened. I'm considering going back to this. Now, this involves needles and veins. Whereas before, I would stick needles into my stomach, kind of like, I don't know, there's like those glucose people, like people with diabetes or whatever, when people stick a needle into their stomach and then just put in the medication. If I go back to this, it's harder because I have to now stick needles into my veins. And I had done that for years. I have large veins, right? But as I gain more weight, it's harder. This is shit because, when you don't take your medication, if you're not taking your asthma, if you're not taking any medication for your heart, if you're not taking your medication for AIDS or for glucose shots or anything, epilepsy or whatever medications you take for whatever disorder you have, and you just go shit. For me, the bleeding would increase. This is fucking bullshit because this program's been around for a long time. Calling them doesn't work. It's not like this government program isn't like, let's say, CVS Pharmacy. Let's say some people call CVS Specialty Pharmacy, and they use that, and there's a representative. There's Joanne or Mike or Cheryl or Dave or whoever it is you talk to, right? Your favorite advocate who's there to help you get your orders processed. There's nobody like that at the government program. Nobody. No fucking buddy. So that's a big fuck you. So now I'd have to go through emails. It's people trying to do things on their end, and I'm trying to do things on my end. But this has been going on too long. Now with this, I have to infuse more than the Hemlibra. With the Hemlibra, at best you would infuse once every 30 days. Here it's once every other day. Sometimes every day if there's a bleed. This is fucked. So I know this doesn't have anything to do with people, but some maybe Kowalski has a disorder. Maybe maybe other people who come on here they see my video. Maybe they have a problem. Maybe you've got asthma. Maybe you've got some sort of cancer. Maybe you have to take therapy. The insurance companies don't want to help you get your cancer into remission. Something goes wrong. We take for granted. We see donations and charities to find a cure for cancer, find a cure for disorders, and we just have to think it's these insurance companies and it's these pharmaceutical companies that want to make money, and it's like we're suffering. The cure for hemophilia is around the corner. There's only 16,000 of us in the United States that have the disease severe. 40,000 just with the recessive, right? Or total. Um, Enough's enough. I'm at this point where I'm fucking pissed. I'm fucking pissed off. I threw this phone against the wall. Luckily, my phone is not damaged. My hands are tied. I can't do anything, and it's fucking ridiculous that I have to call 20 people to get this settled. This is supposed to be insurance. They're supposed to do their fucking job, and they don't do fuck all. It's ridiculous. I didn't ask for this shit. My mom did this to me. We need when my doctor, and I can't blame my primary care physician, when my doctor signed me on to Hemlibra, the newer medication, right? The monthly medication, nobody really knew. We just assumed, okay, I sign on for this. The doctor gives it to the insurance companies. The insurance companies foot the bill for the medication. We pay the note. We, as the patients, we pay the note for the insurance, the companies to keep doing their job. What a system, right? No, there's this in the middle. Now we're stopping dead stop. That's ridiculous. That has to stop. You're going to kill people this way. What they should have done was given a month notice. That's what their dumb inbred asses should have done. So yeah, no, I'm not happy with this at all. I'm very pissed. I had just that one dose of Hemlibra that's kind of old. That's all that I've got. That's all that I have. That's it. I don't have anything else. I don't know what to do. This is just the training kit, as you can see, to help you, just to help you learn how to inject yourself. I already know how to do that. I've been learning how to infuse for almost 20 years. I've never seen this kind of unprofessional behavior. Anyway, drop a like. You know what to do with this video. Shove it up the asses of the people at my it's the genetically handicapped persons program. They're not doing their job. Shove it up their asses and let them know.